Hi dear students, welcome back to the next lecture on basic bacteriology. And today, as I've told you in the previous lecture, that we're going to start with culture media. Now you'll see a chapter called culture methods. Okay, culture methods, there has been no questions yet. So going into so much of depth into that is not required. Okay, so let us discuss about culture media. Okay, culture media. Now broadly, dividing culture media, you can get two types of media: simple media and complex media. Okay, simple media and complex media. Simple media means it contains basic growth ingredients like containing nutrient growth, okay, or some very basic ingredients which is not very significant and not used now naturally because you have got all those. Complex medias which selectively allows the growth of other organisms. Okay, and we'll go into details about each of this media. That is the purpose of this particular lecture. Fine, so let us start. I'll just give you an overall idea and then we'll discuss one by one. Fine, so the complex media can be divided into synthetic or defined media, enrichment, selective, differential, indicator, transport, and anaerobic medias. Now, one by one, synthetic or defined media is purely chemical medias. Okay, purely chemical. Again, not very significant. That means you know the exact concentration of the substance, how much milligrams of this, how much milligrams of that. Again, no, not required. Fine. And your textbook doesn't mention anything about it other than this. No examples, and let us minimize because you have got lots of examples to learn here. So the only way to do that is to by heart revise. Okay, don't worry about, when you see this, don't think that, oh my god, lots of medias, how will I learn it? No, this is how you have to learn. This is where you will have an upper hand when you are learning. Okay, if you learn this, you have got slightly, you have improved yourself. Remember I said you improve 1% every day. Yeah, this is 1%. Okay, that's how, because simply learning your dental pulse will not improve you. Okay, it will just keep you on that constant range and that constant rank. Not just dental pulse, I'm not blaming any book, it's a wonderful book, but overall any MCQ book in that purpose. Okay. So the next is enriched media. Enriched media means it allows the growth of a particular bacteria. Okay, it allows the growth of a particular bacteria. It doesn't influence any other bacteria. Just if you want to grow streptococci, it will grow streptococci. That's it. Okay, and enrichment media is that it, besides allowing the growth of the other bacteria, okay, or sorry, besides allowing the growth of a particular bacteria, it suppresses the growth of commensal bacteria or the bacteria which you don't want. Okay, suppresses the growth of those bacteria which you don't want. That is what is enrichment media. We'll go into details of that, but just understand the differences. Okay, so that's what enrichment. This is just allowing the growth of a particular bacteria. Enrichment means it suppresses the growth of other bacteria besides allowing. So mainly it is suppressing. Okay, and it allows the growth of the particular bacteria which you want. Then you have got selective media, and so the comparison. Now this is basically the difference here is very simple. This is liquid media, this is solid media. Other than that, there is no differences. So anything saying about broth, it is this. Anything saying that it is agar, it is this. Okay, so any broth, it is liquid, it's enrichment, and it is selective. So you will see in your questions, selective media for this particular thing is, so now they interchange this. So the only difference is one is liquid and one is solid. So if they specifically mentioned enrichment media and they give you a broth there, select that. But if you have, no, you'll see the questions, you'll understand it better. Fine, don't confuse it. So they interchanges it. Okay. We'll come into it when you discuss the questions, and if you have any doubts, you can put it there in the groups. Okay, fine. Now, differential media means very typical. It allows the differentiation of two bacteria. Okay, the other ones are like you want to grow a particular bacteria. That's it. Here it differentiate lactose fermenters, non-fermenters. Like in the same group, one group, or in the same type of bacteria, one group ferments lactose, the other doesn't. So that's what differential media. Indicator media, it's a very similar kind of thing compared to differential. You'll see that it's basically, it indicates the growth of a particular bacteria by changing color. Okay, pink. Lactose fermenters will be pink. So the examples of differential and indicator is almost the same. Okay, we'll see into that. Then transport, you know now that there are bacteria need to be transported in a particular media, and thus you have to use it for some bacteria. You can't transport it simply. Okay. Then anaerobic media, certain bacteria require anaerobic conditions, so they have to be done. That has to be grown in anaerobic media. Fine. Now, when I am saying all these, you know, you have some idea what is this culture media is all about, isn't it? What is the purpose of this? You have to identify the bacteria, isn't it? You have to identify the bacteria. Fine. So now let us go on to the next part, which is, you start with, so the first one, which is synthetic or defined media, you don't need to know anything. And here you have to know the enriched media. Okay, you have to start with the enriched media. Let us discuss about enriched media now. Now, regarding enriched media, one thing you know, it specifically allows the growth of a particular bacteria. Now, the definition is the culture media which is required to grow bacteria with exacting nutritional requirements. Okay, exacting nutritional requirements. I'll change the color. Nutritional requirements. So, you know, you have to know this term, because in the definition you will have those to grow the bacteria with exacting nutritional requirements. Exacting means nothing but special. So, special nutritional requirements. They need a particular thing. They need serum. Okay, they need blood. They need egg. Okay, so that's what you can see here. What is added? So into agar you can add blood. So agar or nutrient agar you have, which is a simple media. So you add blood, serum or egg. So you get blood agar, serum agar, not serum agar, I'll tell you the name, and egg agar. Basically that's the combination you have, but blood agar is there. Okay, so that is what those with exacting nutritional requirement or specific nutritional requirements, you use this type of the culture media. Now this, if you add blood, you can get two combinations. It can be either blood agar, okay, blood agar, or chocolate agar. So is it you are mixing chocolate here? No, you are heating blood. If you heat blood and put it, it's called chocolate agar because the color changes. So if without heating, if you put, it's called blood agar basically. Go into a little details about chocolate agar very soon, wait, but basically it is this. Okay, now the serum is Loeffler's serum slope. Loeffler's serum slope. Okay, serum slope. What's the bacteria here? Corynebacterium diphtheria, isn't it? Slope, quick diagnosis. Loeffler's serum slope. Now, with egg, it is Dorset's egg media. Okay, Dorset's egg media. For what? It's for tuberculosis, isn't it? It's for tuberculosis. So, yes, so this is for now, blood agar. Where did we see this? Streptococci, alpha, beta, gamma hemolysis. Isn't it? Alpha, beta, gamma hemolysis. This is very typically Neisseria we have seen now. This is not very significant, Neisseria. Okay, what is more important? You know this. Corynebacterium diphtheria, isn't it? Corynebacterium diphtheria. Dorset's egg media, tuberculosis, MTBL, right? Okay, Mycobacterium tuberculosis. Now, what is basically chocolate agar? Just know the composition. It is sheep blood, heated sheep blood. Okay, sheep blood. Then definitely nutrient agar, which is a simple media. Okay, nutrient agar plus hemin. Okay, hemin. Hemin means it's a part of heme. You are heating it, you are separating the hemin there. So it's called X factor. This is my purpose of writing all this. It's called X factor. Plus you have got one more thing, which is NAD plus. Okay, NAD, nicotinamide adenine dinucleotide. We will study into details of this in biochemistry, NAD. And this is called Y factor. My purpose of writing all this is this. What contains X factor and Y factor? Chocolate agar. What is basically X factor and Y factor? It is hemin and NAD. Now you know where it is used, isn't it? So that's what I told you. If you learn systemic bacteriology and then come to basic bacteriology, it makes much more easy in an entrance perspective. Definitely, if you are learning microbiology as such, as a BDS student, it's good to go for basic bacteriology and then systemic bacteriology. It's fine. But again, I still believe that it's better to go with basic, systemic, then come to basic, and then again go to systemic. It's not stopping there with basics. Okay, so that's about. So those enriched media means those to grow those bacteria with the exacting nutritional requirements. And what is added? Blood, serum or agar. Blood agar or chocolate agar. Now you know what is chocolate agar. Okay, and serum when added, it's called as Loeffler's serum slope for Corynebacterium diphtheriae. Then egg added, it's called Dorset's egg media for Mycobacterium tuberculosis. And chocolate agar, where you have got heated sheep blood plus nutrient agar and hemin and NAD, which is X and Y factors respectively. Next, you have got enrichment media. Enrichment media. So one thing we said, what is it? It suppresses, okay, suppress commensals, okay, commensals organism. And second thing we said, it is a liquid media. So two very important things. Enrichment media is it suppresses commensals and it's a liquid media. Now I've written a skeleton, okay, for all the slides. Purpose is, now when I write it in a lecture, it becomes very shabby and students would understand it. So because these terms are, it's very, you have to be very clear about the spelling. So that's why I've given a skeleton out there, okay. And it can be made very quick if it is given. So these are the examples. Now you know tetrathionate broth, selenite F broth, both used for Salmonella typhi and paratyphi. Yes, tetrathionate broth and selenite F broth. Alkaline peptone water used for Vibrio cholerae. Vibrio cholerae. Now, see, we said tetrathionate broth for Salmonella typhi and paratyphi. So what does it suppress? I'll just write it cross. Otherwise, you'll think it is for this particular bacteria. What does it suppress? It suppresses E. coli, Enterococcus coli, Enterocoli. Okay, E. coli. It suppresses coliform bacteria. Okay. Similarly, here also it suppresses E. coli and it allows the growth of the Salmonella typhi and paratyphi. Just write it there. Salmonella typhi and paratyphi. It allows the growth and suppresses E. coli. Okay. Alkaline peptone water. It is used for, as I've told you. Yes, I'll just take it like this. Okay. Vibrio cholerae. You don't need to know suppresses because it suppresses everyone else. Okay. It suppresses everyone else except Vibrio cholerae. So that's about the enrichment media. Don't forget enriched and enrichment. Enriched allows the growth of a particular bacteria, and this one, it suppresses the growth of a commensal bacteria. It's a liquid media. That's the difference from others are basically agar medias. Now tetrathionate broth, selenite F broth, alkaline peptone water. Vertical learning. So Salmonella typhi, paratyphi, and Vibrio cholerae. Now, it will not make sense to learn it like this. Some students have told me, so if you learn it like this, is it going to increase our knowledge? No, because if someone asks you what is used for tetrathionate broth, after maybe 5 years, you won't remember, because unless and until this page comes to your mind or your notes page come to your mind, you won't remember. But is that your purpose? No. Your purpose is to learn it quick and build up photographic memory, and the best way to build it is vertical learning. Okay, so please try as much as possible to go for a vertical learning methods. Next, you have got selective media. Now, as I've told you, selective media is a solid media, and yes, it suppresses the growth of commensal bacteria. So it's same as enrichment, except it is a solid media. Now, examples are DCA, that is deoxycholate citrate agar. Okay, deoxycholate citrate agar. TCBS, that is thiosulfate, citrate, bile, sucrose, agar. It's not easy. Revise. You have to revise it. It will not, like other concepts went inside, this will not go in. The only way is to revise them. So it's thiosulfate, citrate, bile, sucrose, agar. Okay. Thayer-Martin media, and one more, Lowenstein-Jensen media. Something is coming, and then it slowly it will come. In exam also this will happen. It will not come all of a sudden. There will be confusions. Okay, but you have to wait. In exam, I've seen students, see a question, they don't remember exactly, they get confused and they forget it. Instead, give some time, a few seconds, so that it comes to your mind. Fine. So let us see, where is it used? Deoxycholate citrate, Salmonella, Shigella, isn't it? Salmonella and Shigella. Salmonella and Shigella. It's a selective media for that. Now, then TCBS is for what? Vibrio cholerae, isn't it? Vibrio cholerae, yes. It's for Vibrios. Now, this TCBS agar, you don't need to learn the full form and all. TCBS agar is used to know between sucrose fermenters and I'll write it as like this, non-sucrose fermenters. Okay, sucrose fermenters and non-sucrose fermenters, Vibrios. Okay, among the Vibrios. You don't need to go into detail, except this, if they ferment, they will give you a yellow color, and if they don't ferment, it will give you a green color. So let's, green color. Okay. Now, what does it mean? It's an indicator media. We'll soon see it's an example of indicator media. So I'll not repeat it again. Fine. So TCBS is a selective media plus it is an indicator media. Why? For what? For Vibrios. Why? Because sucrose fermenters will be showing yellow colonies, non-sucrose fermenters will be showing green colonies. Okay. Thayer-Martin media. Now Taylor-Martin for what? Taylor-Martin transported in, remember, yes, Neisseria, fine, Neisseria, and Lowenstein-Jensen, you know it, it's Mycobacterium tuberculosis. Okay, so I'll just repeat once again. Now this is very problematic area, isn't it? So we'll just have a quick repeat. Examples only. Enriched media, blood agar, Loeffler's serum slope, Dorset egg media, Mycobacterium tuberculosis. Chocolate agar, you know this, I'm not going into details of that. Factor X and factor Y. Then enrichment media, it is tetrathionate broth for E. coli, for Salmonella typhi, paratyphi, selenite F broth for Salmonella typhi and paratyphi, alkaline peptone water for Vibrio cholerae. And then we came on to the selective media, which is solid. It is, so it's good to know this like this. Solid. Okay. So SS, which is solid. This. So what is liquid? So learn one. Liquid enrichment. So what is enriched? Allows the growth of one bacteria. So enriched, enrichment, selective. So now DCA, deoxycholate citrate agar, Salmonella Shigella, TCB is an indicator media used for Vibrio. Then you have got Thayer-Martin media, you know it, Neisseria, and Lowenstein-Jensen media for Mycobacterium tuberculosis. Fine. So now the next what we're going to see is differential media. Now before going on to the next topic, I want to discuss with you a very important part, that is the 4 steps of learning. You studied the learning process. Now there are 4 steps of learning for NEET MDS. Okay, the 4 steps now. These are based on experiences of preparing for NEET and based from myself, again, yes, me, and definitely the students, our students, and all the experiences so far we could combine. Okay, it's not like, this is the only way, no. But if you understand this, you can create your own ways and all. So basically, it involves 4 steps. One is learning the basics. Okay, learning the basics. Now, second is learning new and difficult areas. Learning new and difficult areas. Then advanced learning. Finally, tactics. I should say tactics of solving MCQs. Now, along with that, I'm going to discuss with you. Some students ask me, sir, I don't get time for solving MCQs. So should I do it or should I wait till the end? I do all the lectures. I'm very confident now. I've given all my best in lectures and very confident. I've been revising notes. I'll tell you, you're just doing the 50% of it. Okay, what you're doing is only the 50%. If you're doing only lectures, no, even I would say less than that. I'll tell you why. See, learning the basics. Now, let us take the examples of what we're doing right now. Learning the basics. What is selective media? What is enriched media? What is enrichment media? You understood now, isn't it? You understood what these medias are. That's what is basics. What is new and difficult areas? Examples. Now, this definitely comes with revision. Now, students say that, sir, I learned it very well that day, but now I forgot. I remember only few things. What do you remember now? You remember only the basics because you didn't revise. That's a big problem faced by many students. Only if you revise, new and difficult concepts will go in. And the more you revise, more, see, your notes will contain, if you just divide your notes content, it will contain very basic things which right away it goes in. Doesn't mean that you shouldn't learn others now. That doesn't mean that you shouldn't learn examples now. No, you should learn everything, but what goes inside is only the simple basic things initially. Others will be like a kind of, something is there but majority is not there. You revise, then you will start learning some examples, not all. Okay, some examples. Then you revise further, more examples start coming. More. Just examples in the sense, examples of culture medias. That's how you learn. You take anything, streptococci, not everything will go in the first to go. A few things, few very basic things, maybe classifications, a basic classification, something like that goes in. Not everything, not all toxins will go in, not every cultural characteristics will go in. So more you revise, so more things go in. So the key is not sitting with a particular topic the whole day. Instead of that, try revising. Quickly do what is there. You've understood concepts, just do it, revise the rest of the time. Okay, now what about advanced learning? Now see, you understood everything about streptococci, you understood the concept of streptococci, or let me take just one example, or for those who don't understand the example of streptococci, let me tell you the example of arrhythmias. Okay, arrhythmias, very confusing topics for many, but in fact it is not. Okay, we'll go into that. Or much better is anatomy. Okay, anatomy. Now you understood some details on oculomotor nerve. Okay, you know how it causes. You understood, not you by hearted. You have understood. Okay, now once you have understood, some students say me that, sir, but I still see some new questions in my MCQ book. See, the purpose of the academy is to make you understand what is the key, what is the core area. Now, once you understand the oculomotor nerve, any big question on that, you can learn. Definitely, the lecture will not contain everything what you require. Okay, the lecture will not contain every bit of details on oculomotor nerve. So, but once you listen to lectures, once you write down the notes, once you revise them, definitely revise them, then maybe after 2-3 months in a test paper, you see a question on oculomotor nerve which you have never exposed to. Okay, a question on oculomotor nerve which you have never exposed to. But the topic of oculomotor nerve you have been exposed to. But a question which is completely new for you, but you can learn it. Isn't it? You can learn it once you know what is an oculomotor nerve, what is arrhythmia, okay, what is ECG, what is leukemia. So you don't know now. I know many of you doesn't know what leukemia is all about. No idea. Maybe some people know that it's a kind of blood cancer, leukocytes. Okay, increase, but no idea other than that. But once you have a clear idea about leukemia, anything new which you get as a part of questions, you can easily solve. You can easily learn it, not solve it. You can easily learn it. That's how the next process goes. Okay, so now that's why Ted told you have to solve MCQs. You have to keep on solving MCQs as much. No, what it's there in your MCQ book, Pulse, or any other. If you want to do Arvind Arora, fine, or any other books which suggest, do that. You don't need to just search for it. What is there in front of you, do that. Okay. And doing the academic questions, sufficient test papers are coming. It's just the beginning. So lots of test papers are coming. You're going to have grand tests. You're going to have subject-wise tests. You're going to have mock exams, revision test series. So lots of exams are coming. So do as much as possible. Why? Because this is where you learn advanced things. Once your concepts are clear, once your new and difficult areas start becoming clear, when will this area become perfect? When will this area become perfect? Never. Never. New and difficult areas will never be perfect. You cannot perfectionize it. You can perfect your basics, but you can't perfect this area, even during the exam. But at least, as I told you, you can do a good bit of this, 60 to 80% of this, okay, or even 90% of this by the exam. So it will take entire revision phase till your exam to perfect this. But should you wait for this till then? No, it's not like that. Start solving MCQs, learn more, new things will keep on coming. And then you reach here, tactics of solving MCQs. Many people, many students has got a big misunderstanding that in my exam, I'm going to sit in a particular, like I'm going to sit for the exam, and I'm expecting out of 240, 200 questions will be taught by a particular academy and 40 maybe they will not teach me. Very big misconception, very big misconception. No coaching center can teach you 200 or 220 or 240 questions. No. How much can we teach you? It's not about teaching you questions. It's all these lots of things which is yet to come now. Slowly by slowly, as we progress, we'll understand the learning process, how to revise. So it's all about teaching you this. Okay, the entire year is teaching you the tactics of solving MCQs. We'll teach you the knowledge, we'll teach you the basics, we'll give you the new things, we'll give you the advanced things. But if you have all this, still, if you don't have this, means you sit for the exam, you won't be able to reach that 220, 230 mark of questions. How much questions to attempt? 220 to 230. Yeah, 220 to 230. It's not 160. Some students say that I was very confident in 160, so I attempted 160, 180. No, 230. I'll tell you how and what, but you have to learn this slowly by slowly. Do that, you have to do as much as test papers, analyze yourselves. Where are you going wrong? You have to see. Please, dear students, attempt the test paper and see where are you going wrong and see why are you going wrong. What process made you forgot it, or what thinking process you thought, like you say, no, I thought like that. So realize where did you go wrong. Attempt more. Don't think of negatives unless and until it is an absolutely new question. Attempt it. Okay, if you have some knowledge about a question, attempt it and see why did you go wrong and try not to repeat it. That's how you learn this tactics of solving MCQs. Then you start understanding so tactic of solving MCQs is a completely different lecture I'll take, but this is the learning steps. Okay, this is the only way you learn it. So if you don't solve MCQs, you are missing in two areas which is too crucial. You are missing the 50% of your preparation. Okay, that means you are not competitor yet if you're doing only this. So there are lots of things, isn't it? There are lots of things involved. Write it down, okay? Not just write it down. So when you turn around the pages, you see, okay, yeah, this was said. This is I have to follow. So write it down. Whenever I say, not just your notes, write everything. Fine. So it's very crucial you follow this, and if you don't follow this, you know, it's a kind of 1,000 ingredients. Let us simplify it. Let's make it as 50 ingredients. Okay, 50 ingredients, of which one ingredient is your lecture. Okay, 49 is coming slowly by slowly. Okay, don't worry. Simple things only. Confidence. Okay, positivity, response. Okay, attitudes. Okay, all those things. Simplicity, humility. All these are part of it. Lots of things are coming. Okay, smart working. How to stay positive, how to enjoy your studies. I think we have discussed that. So lots and lots, how to build up the habit of learning. Okay, how to stay motivated, a very important thing. Now I'm sure you people are motivated, so I don't need to teach you that now. It's too early. But one day I'll teach you how to stay motivated every day. You get up in the morning, you feel motivated. Okay, the whole day you are motivated. You go to sleep, at least 80%, 90% of the day you should be motivated. I'll teach you for that. Okay, don't worry. So now let us go on to what is required, which is indicator media, isn't it? The next is indicator media. So the next is differential media, isn't it? Not the indicator media, it's the differential media. Now, yeah, I heard a few of you saying that no, it is differential media, isn't it? So yes, the three important medias are McConkey agar, TCBS agar, we've just seen it, Nagler's media. Okay, Nagler's media. Now McConkey agar, indicator media, very important indicator media, saying that about lactose fermenters and non-lactose fermenters. So who are the, no, you know it, isn't it? Who are the lactose fermenters? E. coli, isn't it? Who are non-fermenters? Salmonella, Shigella. What's the color? Fermenters will be pink. Non-lactose fermenters will be colorless, isn't it? Am I right? Yes, I'm right. So next is TCBS agar, you know it. Sucrose, non-sucrose, yellow, green. Nagler's media for what? Lecithinase, isn't it? Lecithinase by the Clostridium perfringens, you know now. Yes, very good. Perfringens by Nagler's media or lecithinase reaction, where you get an opaque appearance, and those producing lecithinase and not producing lecithinase. Okay, so that's why it's Clostridium perfringens who produce lecithinase. Okay, lecithinase. Just write it down there. Lecithinase. Now, when you come on to the next, it's the same examples you'll see, that is McConkey agar and TCPS. This is not an indicator, no color change. It gives an opaque appearance, but it will definitely be in differential media. That is where they can confuse you. Indicator media is all except they'll give you McConkey agar, TCPS and Nagler's media. Nagler's media is not an indicator media, it's a differential media. It's a differential media. Fine. Now the next is indicator media. One is Wilson and Blair media, the others, yes, the one which I just told you. It's a part of differential as well as indicator. Okay, McConkey is a indicator media which changes color. TCBS is also an indicator media. But besides that, two medias which you should be knowing, it is Wilson-Blair media and McLeod's media. Okay, Wilson-Blair media and Wilson. Okay, Wilson-Blair. Wilson-Blair media and McLeod's media. I'll explain this. Now, Wilson-Blair media is used for Salmonella typhi, isn't it? Salmonella typhi. What does it do? So it's Salmonella typhi. So S. It converts sulfite to sulfide. Okay, sulfide DE, which is black in color. So you get a black colonies. Where is sulfite coming from? Okay, Wilson and Blair media provides a sulfite. So Salmonella typhi has got enzymes to convert sulfite to sulfide. So you get, if this Salmonella typhi is growing, you get a black colonies. Fine. Then you have got McLeod's media. Where is it? Where did you study? Remember something known as tellurite agar? Tellurite agar. For Corynebacterium diphtheria, two mediates we use tellurite and Loeffler's serum slope. We just studied Loeffler's serum slope, isn't it? So serum added media. Okay, so now tellurite agar can be modified by adding or can be modified into, don't need to go into like the composition. Okay, just know it's a modification of tellurite agar, McLeod's media. This contains, now this is used for what? Corynebacterium diphtheria. Okay. Diphtheria. Now what does it do? It can convert the tellurite, okay, the potassium tellurite. So just write KT, tellurite, okay, potassium tellurite into, so this one, okay, it can convert into metallic tellurium, okay, tellurium, which is again black, okay, which is again black. So potassium tellurite into metallic tellurium. Now, is it very significant to learn this? No, but just to know it, okay, you get black colonies. Why do you get? Because it converts potassium tellurite into metallic tellurium, where it is black. So two very important indicator media, Wilson-Blair media, McLeod's media. Wilson-Blair is Salmonella typhi, and for Salmonella typhi, which converts sulfide into sulfide. Then McLeod's media, modification of their tellurite agar, which is used for Corynebacterium diphtheria, which converts potassium tellurite into metallic tellurium. Quick review. This lecture is going to be very big. Okay. Enriched media. What are the exacting requirements? Blood chocolate agars. Yeah, just know we saw serum, Loeffler's serum slope. Egg, Dorset's egg media. Okay. And then we saw, yes, enrichment media. The tetrathionate broth for Salmonella typhi, paratyphi, selenite of broth. Again, the Salmonella typhi, paratyphi, alkaline peptone water, Vibrio cholerae for enrichment media because it suppresses the commensals in their liquid. Selective solid, DCA, TCBS, Thayer-Martin. Okay. Then the Lowenstein-Jensen. Then differential media, McConkey, TCBS, Nagler's. Then you come on to the indicator media, Wilson-Blair, McLeod's. Okay, Wilson-Blair and McLeod's. Transport media, you know it. I don't need to explain it as well. Stewart media for the, yes, it's used for what? Neisseria. Okay, it's used for Neisseria. So, Neisseria. It's used for Neisseria. Isn't it? For Neisseria. Now, this Stewart media, you have to know a little details about it at this stage. It is a non-nutrient media. It doesn't contain any nutrition which promotes the growth of Neisseria. So you are just transporting it from your one place to another. So you don't require nutrient. You just need to suppress the inhibitors. If there is anything which inhibits the Neisseria, that is what you need. So it's a non-nutrient media. It contains a reducing agent. Okay, it contains a reducing agent. And it contains just agar, soft agar. Okay, agar is just a base, isn't it? A base for the media. So soft agar gel, and very importantly, it contains charcoal. Okay, and this charcoal is what is the substance which neutralizes the bacterial inhibitors. So it neutralizes the inhibitors. Okay. So just know it's a non-nutrient media. If you know it's a non-nutrient media and it contains charcoal as a neutralizing agent for bacterial inhibitors, you know Stewart's media. Buffered charcoal saline, just know the example, and it's used for enteric bacilli. That is those bacilli in the intestine. Just know this much. Okay, enteric bacilli. So two media transport Stewart's buffered charcoal saline. Quick review. I want you to study this today. Okay. So enriched, okay, enriched media, blood, chocolate, Loeffler's serum slope, Dorset's. Now it's very thorough. But enrichment, tetrathionate broth, selenite of broth, alkaline peptone, water. Selective media, DCA, TCBS, Thayer-Martin and Lowenstein-Jensen. Then you have got differential McConkey, TCBS agar, Nagler's media, no confusion. Then you have got the indicator Wilson-Blair, McLeod's. And then we studied transport, which is Stewart's media, and buffered charcoal saline media. Then you have got anaerobic media. Now, anaerobic media, you've got two examples. One is Robertson's cooked meat and thioglycolate media. Thioglycolate. So, many students will confuse now. Thioglycolate. Okay. So, T. So, let us see all those starting with T. Tellurite. Okay. No confusion there. Corynebacterium diphtheriae. Okay. TCBS. Okay. TCBS media, which is thiosulfate. It's also there because it's a selective media as well as in differential media. So TCBS, Thayer Martin, no confusion because I had it, so that's why. Tetrathionate broth, it's a different story. Okay, and yes, nowhere else, no? That's it. So just revert back. When you have some confusion, solve that confusion then and there. Okay, otherwise that confusion will remain. So this is thioglycolate media, and Robertson's cooked meat media. Now, Robertson's cooked meat media, any anaerobes, facultative anaerobes, you can use it, okay? Because we have used it even for, I think, staphylococci, isn't it? Not very significant, but just one example. Now, thioglycolate, it has got a speciality. Now, all anaerobic media has got a reducing agent. Why? Because you are growing anaerobic bacteria, isn't it? So you don't need oxygen, so just reduce oxygen there. Okay, reducing agent. Now thioglycolate has got a speciality where it will have 3-layered growth. At the top you'll get typical bacteria. In the middle you have got another typical bacteria, and at the bottom you'll have another typical bacteria. So in the top, at the top, what bacteria do you have? Now this will shock you. There is strict aerobes, okay, or obligate aerobes. Obligate aerobes, because still there are some oxygen remaining, and when you grow the bacteria, you will see some obligate aerobes are growing. And here you will get microaerophilic, that those bacteria who survive on very little oxygen. They need oxygen but very little oxygen. If there is too much of oxygen, they will also die. So very little, but they need oxygen. And here is where you get the obligate anaerobes. So if you want to culture them, if you typically want the obligate anaerobes, you have to take the bottom layer. Okay, so that's what is thioglycolate. 3 layers. Okay, 3 layers of the growth. So you just know it's very simple. Obligate aerobes on top, microaerophilic, anaerobes. Next, we will see the media to culture fungus. Media to culture fungus. Just one example you have to learn. You will see this as you go on learning about fungal infections and all. There's only one media used, Seborrhoeic dextrose agar. Okay, potassium hydroxide is also used, not for the culture purpose, but for the diagnostic purpose. You might have seen it. But anyway, that we'll go on to when we discuss fungal infections, we'll see that. But here it's Seborrhoeic dextrose agar. Few things you have to know about Seborrhoeic dextrose agar. Now, Seborrhoeic dextrose agar contains glucose or maltose. Not very important. Okay, glucose or maltose. It can contain any sugar. Okay, then you've got a mycological peptone. Again, I don't think it's very significant. Mycological peptone, just for the completion's sake, but more importantly, it has got a very low pH. Low pH, which is 5, which itself is very much antibacterial. Bacteria cannot survive at low pH. It needs somewhere in the range of 7. So low pH antibacterial, and some also contains antibiotics. So what I'm expecting here is probably maybe this as a question, if at all. Usually they'll ask you what's the media used. So it's low pH, which is antibacterial. Okay, that's enough. Okay, that's enough. Now, incubation of culture media, again, not very important, but just to teach you a small concept here, how they grow, anaerobic and other bacteria. So anaerobic requires a long period, a very long period, that is 7 to 14 days. You have to incubate it, 7 to 14 days. For this much days, you have to incubate and then take the culture to see the growth. Okay, 7 to 14 days at 37 degrees Celsius, body temperature. That's where bacteria grow. Whereas others, including aerobes, facultative anaerobes and everything, microaerophilic, whoever you take, it usually takes much less time, but at least 48 hours at the same temperature. Okay, at least 48 hours at the same temperature. Fine. So means quick, 2 days. That's 7 to 14 days. Here, it is the same time, 48 hours, okay, minimum of 48 hours, but the temperature is varying here. For bacteria, you use 37 degrees Celsius. For fungi, you use less temperature, that is 22 to 30 degrees Celsius, much lesser temperature, that's 37. So, where is the variations? For the bacteria, the variation is, for anaerobic, you have got 7 to 14 days. For aerobic, just 2 days. Okay, comparing the bacteria and fungi, it's same as others or general bacteria, 48 hours, but the variation is the temperature. It's 37 degrees Celsius, this 22 to 30 degree Celsius. Fine. So now next, just a finishing touch, media for special use. Okay, media for special use. So this is something known as CAMHA and CHROM. Just to finish it, okay, there's no question yet seen here. Just write the name and by heart it. Carbon adjusted Muller-Hinton-Agar, which your textbook says about it, and it's used for checking the antibiotic sensitivity. Okay, you know what is antibiotic sensitivity. Now, if to check if any bacteria is resistant or not resistant. Okay, to check if an antibiotic will be effective or not. So for that we have got CAMHA. We can remember that no one is going to ask you the short form or the full form, carbon adjusted Muller-Hinton-Agar. Okay, which is for antibiotic sensitivity. And there is CHROM, controversial term. So don't learn the full form. Different references say it differently. Just remember CHROM. Okay, and it's used for Candida, specifically for Candida. Again, I've not seen them use maybe new things. For Candida also, they use the one which is Seborrheic. Okay, so that's the end of it. I'll just quickly go through the examples once again. Okay, just the examples. Enriched culture media as we started. Okay, we said enriched media, blood again. It's boring, isn't it? Blood agar, chocolate agar. Serum, Loeffler serum, slope, Corynebacterium, diphtheria now. Egg, Dorset's egg media. Chocolate agar, you know it, it contains semen and NAD, factor X and Y. Enrichment media suppress the commensals, they are liquid. And tetrathionate broth, selenite F broth, alkaline peptone, water for Vibrio column. This too for Salmonella typhi and Paratyphi. Okay, so then selective media, which is solid, DCA, TCBS, Thea-Martin. TCBS you know now, okay, it's an indicator media as well. Okay, now differential media, again it's a differential media also, indicator media also. So McConkey agar, TCBS, Nagler's media, which is not a indicator media, remember that. Then you have got 4 steps, indicator media, Wilson, Blair, others besides others. Then you have got McLeod's. So then you have got Stewart's media for transport and buffered charcoal. Only thing I told you, it's not nutrient media. Okay, it contains charcoal for neutralizing the toxins. Okay, then you have got anaerobic media, which is Robertson's cooked meat and thioglycolate, 3 layers of bacteria. Media to culture fungus, Seborrheic dextrose. I told you low pH is a key here. Okay, then yeah, now see, as I've told you, it's step-by-step learning. First you learn this. If you're finding it difficult, learn something which is very crucial. Okay, then go to the next. Then comes the incubation of culture media, very simple. I've told you, it's anaerobic, more time, others less time. Compared to fungus, it requires lesser temperature. You know, molds grow at a colder temperature. What is molds? Basically fungi, isn't it? Then you come on to the media for special use, CAMHA for antibiotic sensitivity, CHROM for Candida. So that's it. Now in the next class we'll come on to the bacterial nutrition, where we'll understand the oxygen requirements, okay, the temperature requirements of bacteria, difference between exotoxins, endotoxins, and just wind up with the bacterial genetics. I thought like I'll finish them in 2 lectures, but yes, when you update it, you have to put a lot of new knowledge. Okay, there are lots of new areas coming in. So yes, no problem, but still finish it off. You can finish it off in 2 days, isn't it? Easily possible. Okay, so I'll just stop it here. See you in the next class. Goodbye.